Welcome to A History of the LGBTQ community, a presentation developed by SAGE's National Resource Center on LGBTQ aging. We are happy and excited you all have taken the time to learn more about LGBTQ older adults. Your willingness to be here is the first step toward creating spaces where LGBTQ people feel welcomed and affirmed. Throughout this presentation, you will hear the acronyms LGBT, LGBTQ, and LGBTQ+, or the phrase, the community to refer to LGBTQ+ communities. The National Resource Center encourages you to find the language that the LGBTQ+ community and individuals you work with prefer. Today's presentation will last about 20 minutes, and we will have time for discussion and questions. SAGE's National Resource Center on LGBTQ+ aging is the country's first and only technical assistance resource center aimed at improving the quality of services and supports offered to LGBTQ+ older adults. The purpose of this presentation is to introduce you to the unique issues that impact LGBTQ+ older adults as they age. It is important to remember that this is not a training. If you are interested in furthering your cultural awareness on LGBTQ+ aging, please visit the SAGE Care Training and Credentialing Program at www.sageusa.care. Now, let's discuss the two goals of this presentation. The first goal of this presentation is to learn about LGBTQ+ discrimination. To understand discrimination, it's important to consider the history experienced by LGBTQ+ older adults. Understanding personal history is important for everyone, but LGBTQ+ history is often overlooked. It's also important to understand that LGBTQ+ older adults have likely experienced a lifetime of discrimination as well as triumphs. The second goal of this presentation is to help you understand how a history of discrimination impacts LGBTQ+ older adults, particularly LGBTQ+ older adults of color. Understanding the significance of history is important when considering the needs of LGBTQ+ older adults. The lifetime effect of discrimination can be traumatizing, making LGBTQ+ older adults wary of law enforcement and medical care. Intersectionality of disability, race, and ethnicity can complicate the experience of discrimination for LGBTQ+ older adults. To create a welcoming environment for LGBTQ+ older adults, it's important to consider how their personal history and diverse identities may impact their experience. Historical events have a profound impact on us all, and it is important to remember that historical events are lived experiences for older adults. Examining historical events can help us understand the needs of LGBTQ+ older adults and make them feel safe and welcome. It is important to consider how living through these historical events may have impacted LGBTQ+ older adults, especially LGBTQ+ older adults of color. LGBTQ+ older adults of color have faced discrimination based on their race or ethnicity and for their sexual orientation or gender identity. Experiencing multiple types of discrimination can have a cumulative effect on an individual's health and wellness throughout their life. In this presentation, we'll cover important points in LGBTQ+ history by each decade beginning with the 1920s and ending with the present day. We will end with a discussion on how personal history can impact LGBTQ+ older adults of diverse backgrounds. Throughout the 1920s, increased awareness of LGBTQ+ individuals led to changes in the treatment of LGBTQ+ people. In the 1920s, the word gay began being used interchangeably with homosexual. However, as awareness of the LGBTQ+ community grew, discrimination against them also increased. In the 1920s, laws at the state level made it illegal in many places for people to dress in clothing not associated with sex assigned at birth, leading to police targeting of LGBTQ+ people. Police also frequently raided the secret meeting places of LGBTQ+ people, marking the beginning of decades of targeted violence and harassment. This era represents a dark chapter in LGBTQ history, with many individuals experiencing trauma and discrimination because of their identity. In the 1930s, discrimination against gay people increased both in the US and abroad. In Nazi Germany, Hitler denied rights for gay people to organize, and they were forced to wear a pink triangle and sent to concentration camps. In the US, homosexuality was included in a list of sex crimes along with pedophilia and rape, which lead to hate crimes against the LGBTQ community. Portrayals of homosexuality in movies were made illegal. The FBI began investigating people for homosexual activity, spying on and blackmailing them for it for several decades, up until the 1970s. In Europe, Nazi atrocities that began in the 1930s continued into the 1940s and led to 10,000 to 15,000 LGBTQ deaths. For gay men who survived the Holocaust, many were castrated in exchange for freedom from concentration camps. Meanwhile, in the United States, we're not allowed to fight in the military. Despite the tragedies of World War II and the continued discrimination against gay people, landmark research began the normalization of sexual orientations other than straight. For example, the Kinsey scale was published, describing sexuality from gay to straight, with bisexual in the middle. In the 1950s, the communism scare began in the United States, and homosexuality was targeted. An executive order declared homosexuals a blackmail risk and removed anyone who identified as gay or was suspected to be gay from government positions. Homosexuality was listed as a disorder in the American Psychological Association's Diagnostic Manual, increasing discrimination against LGBTQ people in the medical community. Despite the continued discrimination, the LGBTQ community received some notable representation in this decade. In 1952, Christine Jorgensen underwent the first publicized gender-affirming surgery. In 1956, the popular book Giovanni's Room was published and gave positive representation to gay and bisexual men. The 1960s were characterized by the continuation of the civil rights movement as well as the expansion of the gay liberation movement. In 1966, the first LGBTQ uprising in U.S. history happened at the Compton Cafeteria in San Francisco. In 1969, Stonewall Uprising happened in New York City after LGBTQ people were provoked by police. For lots of people, the Stonewall Uprising marks the beginning of the LGBTQ movement. It's crucial to acknowledge that Black transgender women of color, and Black lesbians were at the forefront of activism in the LGBTQ community. Unfortunately, the Black LGBTQ community also bore the brunt of discrimination from law enforcement. In 1970, the first Gay Pride March occurred to commemorate the Stonewall Uprising, and this march continues nationally to this day. In 1971, the Gay and Lesbian Alliance was formed to continue the fight for gay and lesbian rights, and the rainbow flag debuted to represent LGBTQ people. This same year, the Supreme Court dismissed the case Baker v. Nelson, which would have recognized same-sex marriage. In 1973, homosexuality was finally removed from the American Psychological Association's Diagnostic Manual of Mental Disorders. Despite this victory, a study conducted in 1974 found that 80% of doctors refused to treat gay people. In the 1980s, the AIDS epidemic led to the death of over 10,000 LGBTQ people in the LGBTQ community. Although the AIDS crisis began in 1982, President Ronald Reagan did not acknowledge the AIDS crisis until 1987. AIDS was considered a gay disease by many, giving way to more discrimination towards gay people. Today, public health officials and epidemiologists agree that the AIDS crisis was preventable, but in prevention was hindered by homophobia. Without support from the government, the LGBTQ people took the fight against AIDS into their own hands. In 1987, the AIDS Coalition to Unleash Power, or ACT-UP, was formed to fight AIDS and advocate for the 42,000 AIDS victims across the LGBTQ+ community. In 1987, the Second National March on Washington happened, bring awareness to the AIDS crisis and call for action to end the epidemic. In the 1991 DC Black Pride, an annual celebration for Black LGBTQ+ people, began to recognize the disproportionate impact of the AIDS epidemic on Black people and people of color in the LGBTQ+ community. In 1991, Magic Johnson announced was HIV positive, which gave recognition to the fact that AIDS is not a gay disease. In the 1990s, legal advances for LGBTQ+ people included the American Disability Act being expanded to protect people with HIV/AIDS from discrimination. Despite advances, in 1993, the U.S. government enacted Don't Ask, Don't Tell. Don't Ask, Don't Tell, which prevented the military from discriminating against closeted gay, bisexual, and lesbian individuals, but still allowed discrimination against those who were openly out. As a result, many LGBTQ+ individuals in the military were forced to conceal their identities. In 1996, the Defense of Marriage Act was defining marriage as between a man and a woman. The 2000s brought an expansion of rights for LGBTQ+ people. In 2000, Vermont became the first state to legalize same-sex civil unions. In 2003, the Supreme Court declared that laws banning same-sex relationships were unconstitutional, paving the way for federal LGBTQ+ protections. In 2004, Massachusetts became the first state to legalize same-sex marriage. In 2009, the Matthew Shepard and James Byrd Jr. Hate Crimes Prevention Act was enacted. This legislation makes it a federal crime to commit violent acts against an individual based on their actual or perceived sexual orientation, gender identity, or gender. In 2010, the It Gets Better campaign was launched to encourage LGBTQ+ who have alarmingly high rates of suicide. In 2011, Don't Ask, Don't Tell was repealed, allowing LGBTQ+ people to serve openly in the military. In 2014, the Obama administration lifted immigration restrictions against people in same-sex relationships. In 2014, Laverne Cox became the first Black transgender woman to appear on the cover of Time magazine. In 2015, Obergefell v. Hodges found that the Defense of Marriage Act was unconstitutional and ruled that same-sex marriage is constitutional. In the 2000s, there were also important LGBTQ+ inclusive international developments. Despite these advances, there have been setbacks in LGBTQ+ rights in recent years. In 2016, tragedy struck the United States, with the shooting at the Pulse nightclub in Florida, which killed 49 LGBTQ+, the majority of who were LGBTQ+ people of color. In 2017, President Trump administration ramped up discrimination against LGBTQ+ people by signing an executive order making it illegal for transgender people to serve openly in the military. In 2018, the Supreme Court ruled that businesses could turn LGBTQ+ people away for religious reasons. In 2020, the Trump administration permitted medical professionals to turn away LGBTQ+ people. In this same year, the Trump administration banned DEI training about LGBTQ+ people from being conducted in government agencies. However, in 2020, the Supreme Court, in Bostock v. Clayton County, ruled that LGBTQ+ people are protected under the Civil Rights Act, and that LGBTQ+ employees cannot be discriminated against. In 2021, Biden administration began removing Trump-era executive orders, including the transgender military ban and ban against diversity training. In December 2022, President Biden signed the Respect for Marriage Act into law, which enshrines same-sex and interracial marriage into federal law. The signing of this landmark legislation not only federally protects same-sex couples and interracial couples. Although there have been positive developments, there have also been setbacks in LGBTQ+ rights. In 2022, a shooting occurred at Club Q, a LGBTQ+ nightclub in Colorado Springs. The shooter specifically targeted the venue and resulted in the deaths of 5 people and 17 others were wounded. There have been several anti-LGBTQ+ laws passed or proposed in various states in recent years, including laws that restrict transgender people's access to public restrooms or participation in school sports based on their gender identity. Other states have passed laws that allow businesses to refuse service to LGBTQ+ people based on religious beliefs. Now that we've talked about the history of LGBTQ+ rights and discrimination, let's shift our focus to how past and present events currently affects LGBTQ+ older adults. Growing up, living through a life of discrimination and experiencing discrimination has a profound effect on LGBTQ+ older adults. Can have unique challenges for LGBTQ+ older adults. Unfortunately, throughout history, discrimination against LGBTQ+ older adults have been pervasive in medical, legal, and social contexts. As a result of experiencing medical, social, and legal discrimination, many LGBTQ+ older adults may feel distrustful towards legal authority, healthcare providers, and the people around them. For example, an LGBTQ+ person who was born in the 1940s or 1950s might have experienced discrimination from healthcare workers who were supposed to help them, police officers who were supposed to protect them, and the government that was supposed to serve them. The impact of this discrimination is still felt today, as LGBTQ+ older adults may be hesitant or anxious to reach out for help in their communities, even if the people they need to reach out to are welcoming and affirming. Experience of discrimination across the life course leads to health and well-being disparities for LGBTQ+ older adults, and greater financial challenges in later life. Because of historical trauma, spaces for older adults need to be openly and proactively affirming of LGBTQ+ identities through signage and policy so that LGBTQ+ older adults know they are welcome, even if they still do not feel comfortable being open about their identities. People and providers need to keep in mind that LGBTQ+ older adults might not want to be open about their identity. This means that even if you think you do not interact with any LGBTQ+ older adults, it is still important to show your acceptance. These experiences are amplified for LGBTQ+ older adults of color, who have experienced a history of discrimination for not only their sexual orientation or gender identity but also for their race or ethnicity. The intersectionality of race, ethnicity, disability, and LGBTQ+ identity can create a distinct personal history for individuals. Therefore, it is crucial to recognize that diverse identities play a significant role in the impact of personal history on LGBTQ+ older adults. For example, throughout LGBTQ+ history, Black trans women often experienced more policing, violence, and discrimination due to the intersection of their race and gender identity. Black trans women were also at the forefront of riots such as the Stonewall riots for standing up to police discrimination, which gave traction to the LGBTQ+ rights movement. It's crucial to acknowledge that the LGBTQ+ movement is intertwined with Black history, and countless Black people have contributed to the fight for LGBTQ+ rights, including trans women of color, like Marsha P. Johnson and Sylvia Rivera. When learning about LGBTQ+ history, it is crucial to understand that personal identities can lead to a unique experience of history that impacts diverse LGBTQ+ older adults. Now, let's conclude the presentation with some key takeaways from what was discussed. LGBTQ+ older adults have experienced medical, legal, and social discrimination. This discrimination might be magnified for LGBTQ+ older adults of color. By considering how marginalization might impact diverse LGBTQ plus older adults differently, you can be more equipped to make your community or organization welcoming and safe for all LGBTQ plus people. LGBTQ plus older adults face unique challenges due to the discrimination they have experienced throughout their lives. Discrimination can lead to LGBTQ plus older adults being wary of authority and medical professionals, which can impact their physical, mental, and financial well-being later in life. To create a more inclusive community, it's important for organizations and communities to be openly affirming of LGBTQ plus identities whenever possible. Understanding LGBTQ plus history is the first step towards creating a welcoming environment for LGBTQ plus older adults. By acknowledging the experiences of discrimination that LGBTQ plus older adults have gone through, we can ensure that they have access to the social connections, support, and quality care they deserve. As an individual, there are steps you can take to make your community and organization more welcoming to LGBTQ plus older adults, including 1. Avoiding assumptions about gender identity and sexual orientation. 2. Asking open-ended questions. 3. Being mindful about disclosing their identities to others. You can also advocate for LGBTQ plus older adults in your community by educating others and supporting LGBTQ plus affirming care and rights. Now that we have discussed the ways that you can advocate for LGBTQ plus older adults in your community, we will have a reflection question that you can take with you. What are some things you can do to improve your community for LGBTQ plus older adults? We hope that this presentation has helped you think about some answers to this question and helped inform you about the history of LGBTQ plus individuals and community. Are you interested in learning more about LGBTQ plus older adults and how you can better serve those who access your services? Sage Care offers trainings and credentialing for organizations that are looking for more in-depth information on making organizations welcoming for LGBTQ plus older adults. Thank you for your time and attention. If you are interested in becoming a volunteer education ambassador and giving this presentation to members of your own community, you can go to the National Resource Center on LGBTQ plus Aging's website, www.lgbtagingcenter.org. There are also more trainings pertaining to LGBTQ plus older adults available through the National Resource Center that you can learn about through their website, www.lgbtagingcenter.org.